Welcome to BW Dialogue series of Business World Healthcare. Our guest today is someone who's been a seasoned global professional with over 21 years of diverse experience in business management in various geographies like North America, Asia, and Africa. And his focus for the last 17 years has been healthcare. He has led business transformation and financial turnaround of acquired healthcare companies in India, Mauritius, and Vietnam, and has created a sustainable growth momentum and value for these organizations. The gentleman with us today is none other than Mr. Raj Gore, the CEO of Healthcare Global Enterprises Limited, better known as HCG. He is someone who has built the performance of teams and implemented organization-wide transformation initiatives successfully to improve not only employee engagement, but patient satisfaction in cross-cultural environments. He has hands-on experience, hands-on knowledge of the M&A spectrum, including the post-acquisition integration. Welcome to Business World Healthcare, Mr. Raj Gore.
Hi, Harbinder. How are you?
My first question to you is that you've been in the healthcare space for 17 years out of your 21 years of working experience. Yeah. And you have been involved in M&A, which means that you have studied various healthcare organizations very, very closely. Now, what are the changes that you have seen in the industry? How has it evolved in the last 17 years?
Personally, I'm an engineer. I dropped biology, didn't want to become doctor, but, life has its way to bring you back to what you run away from. When I moved back from US, one of the reasons I decided to join healthcare is that time the industry was just taking off as a, sunrise industry. And I find this sector so compelling on so many dimensions. On human dimension, and social dimension, political dimension, business or economic dimension. And that's why everywhere, no matter where you go in the world, it evokes very strong emotions, various types of emotions. And, you add to that kind of unique challenges and opportunities that India has. We have issues about accessibility, we have issues about affordability, but our biggest issue is inequality in various parts of India. We have a resource crunch on demand side as well as supply side. I really felt that this is a sector that I would like to join and see how we can face these challenges and try to contribute in whichever way we can as a professional. There's a reason why Peter Drucker called hospital as the perhaps the most complicated enterprise ever created by humankind. Where else you will have so many people from diverse demographic background acting in concert to treat each patient irrespective of that patient's background in a caring, uniform way, facing all these challenges. So it's been a fantastic experience, very rewarding in terms of learning as well as growth. When I joined healthcare, there was one organization which had more than 15, 20 hospitals. Today, you look at how many organizations, I can count 6, 7, right now, so it's really evolved. I was lucky to be at the right time to join an organization that went through tremendous growth phase. And therefore, I got opportunities. I got opportunities to work, in different field within hospital, within different functions, one hospital, multiple hospital, urban, rural, all over India, all parts of India, outside India, primary care set up to like quaternary institutes where the healthcare started in India, single specialty, multi-specialty. So the industry has evolved tremendously. Last 2 decades, and both public, government, as well as private healthcare sector, we made tremendous progress. Public sector has focused usually on creating access through primary and secondary care. Whereas private healthcare has focused on more tertiary, quaternary, specialized care. And as a result, you see last 2 decades, our hospital bed density has gone up from about 0.7 per thousand population to about 1.2 per thousand population. That's like whopping 6.5 to 7 lakh beds addition. That's huge for a country like India. The number of doctors have gone from 0.6 to 0.9 per thousand population. In absolute amount, the number of doctors have doubled. Yet, it's not enough. We are such a vast, country or a continent that it's still not enough. The insurance penetration has gone through, tremendous upside. Private insurance cover has gone from 4.5% to 10%, but government has really stepped up in creating affordability by launching various schemes as a payer. So as a result, what early 2000 we had about 85-86% of population which was uncovered, uninsured. Today it's come down to below 50, it's 47-48%. So we've made tremendous progress, but I think there is still a long way to go. We are not one homogeneous country. We are a country with each state, each region as a separate country, and there is a lot of inequality. So the work continues, but that's the nice opportunity that this sector gives to us professionals.
Tell me, Raj, you spoke about care, and you mentioned, you touched upon the empathy part of the enterprise. But at the end of the day, we are also running an enterprise. It's a business. I hate to call it a business, but at the end of the day, it is an enterprise which needs to be sustainable. Now, how does one, as a healthcare professional, as a healthcare business leader, balance between the empathy part as well as the responsibility to keep the organization running, keeping pace with the technological development that is there? How do you balance this?
I don't think it's mutually exclusive. People who join healthcare, most of them join because it appeals to them. It appeals to their heart, it appeals to their conscience. So it's already somewhere there. But, I think look at from a business perspective. If you do what's right for patient, the patient is going to be the strongest advocate. And the word of mouth is the strongest influencer in this sector. So doing the right thing for the patient is always the right thing for the business. So I don't see it as, anything different. I think it's natural that you have to look after your patients, and that's what is right for the business. So it's very simple.
But isn't there a challenge in making healthcare affordable? Because what happens is we need to develop ourselves in terms of technology, making the most modern equipment available. All this costs money. And we have definitely reached a point where our healthcare in this country is much, much affordable compared to anywhere in the world. But when you look at the local Indians, it is still, a large part of it is still unaffordable. Yeah. What do you think can be done to make healthcare affordable for our own citizens?
I think it's a very complex and a vast subject, but look, I feel India is on the right track. I think what it requires is various stakeholders to come together, and not everyone doesn't have to do everything. There's a role for public sector, there is a role for insurance providers, there is a role for private sector, there is a role for big hospital, there is a role for small nursing home or a clinic. And I think the only way to solve this problem is creating an ecosystem where different providers cater to different segments, because that's how that's the most practical approach. I think sometimes, and that's where I find HCG as unique. You will be, I don't know if you'll be surprised that 2/3 of our centers or hospitals are away from big cities. They're in tier 2, tier 3 towns. We are in a town which is 4 lakh population, right? That is tier 3, tier 4. But we've invested in the more modern radiation therapy equipment, linear accelerator in those cities. We have a model that gives good returns, good profitability in a big city as well as in small city. So I think all you require is a creative, innovative business model where you can, do justice to all stakeholders, mainly patients, but including investors. So, if anyone can figure that out, I think it's India. And I think that's the opportunity we as Indians have, because this is not a problem that is faced by only us, right? You have the biggest economy of the world, US, $23 trillion, who spends 17% of GDP on it, and still has an uninsured population, still has an affordability issue. And we are a 3 trillion population who spends only 3% of GDP, and we have a problem. But I'm betting on our frugality, our ingenuity to find solutions, which cater to this diverse population. And that's, I think we will find a way, we will show the way to the world on how to address some of these issues.
Absolutely. I can't agree with you more. Mr. Gore, as a CEO, what is your vision for HCG?
So, look, I've been in this organization for 18 months now, but this is a very old organization. It was founded in 1989, and the founding vision and mission was to, add life to years of patients through value-based medical excellence and innovation. So we already have a purpose, right? And that's what we've been pursuing. Now, my job is to make sure that we strengthen the system, we strengthen the organization to fulfill that vision mission going forward. We are already the largest oncology provider in India with 24 hospitals. We treat the largest number of new patients. We have the largest installed base of linear accelerator in India and PET scans in India. So our endeavor would be to continue on this path, to continue to bring the latest, the most comprehensive cancer treatments for patients, so that we become the destination when we want to be in a position where people should think of HCG when if anyone can treat this cancer, it's HCG. That's our endeavor. That's our we are working on it, but it's a very tall goalpost that we have for ourselves. But that's what is required in cancer care, because it's such a still largely unknown and rapidly evolving field that this kind of purpose, which is based on research innovation, fuels the passion to push the boundaries of cancer treatment in India.
We've seen that the hospitals and their hospital infrastructure, at least the large hospitals, have been more towards the larger cities, and mostly metropolitan cities. Yeah. We have now started seeing some shift towards tier 2, tier 3. What is your perception of the growth of healthcare in India? And what have you done right in the tier 2, tier 3, which makes you, a profitable organization, yet creating a very positive impact and offering the best services in these cities? And do you think that there's a role that technology is playing?
Absolutely. We have 70%, roughly 70% of population in rural areas where we only have 40% beds. In urban areas, in cities, in some of the states, we measure on certain health indicators as well as the developed world. But yet, when we go away from urban areas, cities, to the rural areas, some of our states, they will rank at the bottom of the list of countries. And I think that for me is the biggest challenge as a healthcare professional, as a country, that we have. However, I think, what has helped HCG is, see, they, the everything that makes healthcare an attractive investment opportunity, is, that is even more attractive when you go away from urban cities, because the competitive, urban cities have become, ultra competitive. Whereas there are many areas where there is nothing is available. All you have to do is get your investment model right, and that is what has helped HCG. Linear accelerator. Many healthcare organizations still hesitate in investing in a linear accelerator, which cost about 20 crores, including the bunker cost. But we've invested in places with 2 to 4 lakh population a few years ago. But what has helped us is, we've been able to refine our cost model and operating efficiencies in such a way and drive volumes, even if it's at a lower price, to make it work for us. So, I think we just have to we just have to find a way and take no, not take no for an answer, to make it work for you. But once you get there, you can command a dominant market leadership position. So out of 18 cities that we are present, 13 cities, we have the #1 dominant market leadership position in private oncology services by our estimate. And that's a strength of the scalable, viable model that we have created. I think in India, the growth will happen in tier 2, tier 3 cities. That's where the biggest demand supply gap is. The challenge is, how do you get the talent to stay in rural areas away from big cities? Because it's natural for most people to migrate towards urban area for better career prospect, for better education prospect for their kids. So there is a challenge in bringing the talent to away from urban areas or big cities. But that's where the technology comes handy. We have our center of excellence in Bangalore, where we have more than 70 oncologists practicing very highly specialized, cutting edge oncology. Now we can't create that kind of setup in tier 2, tier 3 cities. But what we do is, whatever research is happening, whatever new protocols we are finding, new ways of treating patients we are finding, we have a tumor board where every Wednesday morning about more than 150 oncologists across the country join. That's where we discuss the difficult cases, complex cases, latest trends, latest findings. So what happens is, your center of excellence creates this knowledge repository, and with the help of technology, you're passing that across your network. You don't need to replicate, whether it's your medical technology, whether it's such a highly specialized talent everywhere, but you can protocolize what you're learning in one place across the network through the technology. Though we have linear accelerators in many cities, we have a central physics department which does planning for it, which does quality assurance for them. So I think the technology will play a huge role in taking the expertise away from big cities. When we say hub and spoke model, people usually associate hub and spoke model with patient moving from hub to spoke and spoke to hub for various complexity of treatment. For us, it's a way to disperse knowledge, from centers of excellence to rest of the network. I think in India, to address this inequality, the resources will not be as much a problem. It's the talent that will be a problem, and the technology will help us. Today you can help a surgeon doing a surgery in a small cities through, virtual reality, through, we have done one case study where our surgeon from Bangalore, wearing a Microsoft HoloLens technology, was there virtually, almost as if he's standing next to the patient bed on the on the OT table, and helping, the surgeon to figure out what's the best way to access the tumor. So those are things that are possible. They are no more sci-fi, things. They are real things that you can use today to bring knowledge to, cities where there is none. So it's a very exciting time with, how the technology is evolving, digital technology is evolving.
I think, I mean, I almost was visualizing what the future of surgery is going to be. And
Yeah.
it's also very beautiful that, the moment we, in the field of healthcare, when we look at technology, we always relate to the machinery, the equipment. But, the basic technology can be used so beautifully in just sharing knowledge and equipping the other doctors with your own experiences. I think that's very beautiful example of how we could use technology. Now, what I really want to understand is, we recently went through pandemic, and you are a specialty hospital, focusing on non-communicable disease. This is a time when patients were not going to a healthcare facility with the fear of, getting infected with the virus. And especially in oncology, where the immunity levels could be very, very low. Was that a tough time for HCG, and what did HCG do to overcome that particular period?
Yeah, so it was such an unprecedented situation, and evolved so rapidly that initially all of us were grappling, because there was no playbook, there was no prior experience, and all we could do is see which location, which geography, which city, which country is ahead of us in this pandemic, and learn from their experiences and not repeat their mistakes. And it went on for almost 6-8 months before we found a way to manage the situation. I think what hurt cancer patient was the logistical lockdown, because for cancer patients are well aware that delay in treatment can hurt them more than probably the risk of getting infected. It's a time sensitive situation, and the longer you wait, the disease may migrate to a more advanced stage, and that brings down the possibility of getting a better outcome for the treatment. So for us, I think, once you are diagnosed as a cancer patient, you are likely to go through it. You may have apprehensions, but you are not going to delay it. What hurt us was the travel restriction. So we had to find ways to, reach out to them through virtual consults, through home care, make sure that, you compartmentalize them in our hospitals. And luckily, since we are exclusively cancer hospitals, we in most places, we didn't have to admit COVID patients. And that helped us to insulate them, address their fear about getting infected. I think, as the first wave went away, I think it became easier, because then the lockdown was not as strict. First wave was complete lockdown. But I think, we tried our best to reach out to them, convince them, give them assurance that they will be safe. And we managed to do it. I think what we don't know yet, the impact of COVID, is, lot of cancer cancer treatment outcome depends on early diagnosis. And because of pandemic, because of lockdown, we couldn't go out and do awareness activities. We could not educate people about prevention. We could not conduct screening programs. Now that delay, we'll just have to wait and see how it will impact in what stages cancer patients will come in future. We'll just have to wait and watch to actually quantify that impact.
So, Raj, what is your growth mantra for HCG?
I think there are no shortcuts in healthcare. Like I said, you have to get the latest treatment options, latest technology, more skilled doctors. You have to give the most comprehensive treatment in your hospitals under one roof. You have to deliver better outcomes and let word of mouth, give you a multiplier effect. So that's number one. There is no shortcut in that. I mean, we all have gone through our personal experiences where we will always get a reference from someone who's been to that doctor or been to that hospital. So if you continue to do that, you are in a good shape. In cancer, I think we, unlike other specialties, we do not get as many opportunities to reach out to families and community and talk about cancer. It's not a subject that everyone is ready or inclined to listen to. You always think you're not gonna have to deal with something like this. So we have to focus on prevention. We have to focus on awareness. Tobacco is the largest is the carcinogen with largest significant impact on cancer disease burden. Awareness of reducing tobacco consumption, awareness of reducing alcohol consumption, getting vaccinated for human papilloma virus, getting vaccination for hepatitis. These are the awareness efforts. We can go and talk to everyone about having healthy lifestyle, about about making them aware of importance of early diagnosis, regular mammograph after a particular age group. Those are the opportunities we get to reach out to the larger community and educate them. So if and when they need it, they can think of us. And we continue to do that. So reaching out to them keeps HCG brand in top of their consideration set if they ever require our help. God forbid, I mean, they shouldn't. I think for us, I think going forward, I think digital will play a huge role. Our patient group, our patients are very thinly dense, widely distributed, fragmented population base. But increasingly, all of them want to know more about their health, want to know more about their disease, about treatment option, and they go online and do the search, right? They want to get a second opinion. They were not happy with just one opinion. They will make sure they want the involvement in decision making on their treatment. So they will take the second opinion. They may take more opinions before they are sure about where they want to go. But once they are convinced, they don't mind traveling to any part of India or the world if they can afford. So for us, I think creating awareness of what we have to offer to cancer patients through online channels and becomes a very, very important tool for us to grow in future. And we're putting a lot of emphasis on that right now and building that capability across our hospital network. I am betting big on that going forward. And the other thing is, of course, it's an organization that has built on foundation of investing in latest technology and bringing the latest treatments, cancer treatment, because this is a very still, not completely understood disease, and it's very rapidly evolving in terms of treatment. So the more latest treatments, technology we bring, our chances of growing, is that much better. So that's always been a foundation of how HCG has looked at growth in the past, and will continue that on that track.
So Raj, when you look at the enterprise that you run, they for you to enable the best clinical outcomes, there are two assets that you focus on. One is the equipment, and the second is the talent. Now, my question to you is that is there anything that you're doing to maintain happiness and joyousness among the doctors who are usually working in an environment where they're surrounded by sadness, fear? How do you manage that?
I don't remember whose quote it is, but to paraphrase it, it said that happiness is nothing but growth. When you grow, you are happy. And grow means on several dimensions, right? So for an oncologist, what is growth, right? Oncology, as I said, we've been battling this formidable opponent for more than 4,000 years. And probably every president, every other president since after JFK has declared a moonshot saying we're going to, win the battle over cancer. And still we are where we are. We made a lot of progress, but when you have such a rapidly evolving field as cancer, what happens is the only way you can give the best treatment to your patients is stay abreast on latest research, conduct research, and academics. One of the unique thing about HCG is for us, for our clinicians, research and academics is not an optional thing that you may see in other hospitals. It is an integral part of how we treat cancer patients. Okay, so when you have an environment which encourages research, which encourages teaching, which encourages, which invest in latest medical technology, automatically as an organization, we have attracted oncologists from all over India. We have more than 400 oncologists with our organization. Almost all of them work full-time with us. And we have a very robust D&B and fellowship program where fellows, candidates join us and get trained under us. So it's the culture, it's this philosophy of combining research and academics with the cancer treatment is, I think, the key in attracting talent, retaining talent, developing talent, and keeping them happy. Because when you do all those things, when you pursue research, when you drive academics, you grow professionally, you grow as a multiplier by creating more oncologists. You have latest treatments that you are offering to patients, so you have growth in terms of number of patients, and when you grow, you're happy.
So what are the growth and expansion plans of HCG?
We are an organization that went through very rapid growth after we went public in 2016. And I think right now we are in a consolidation phase because I think in a huge demand supply gap market like India, in any sector, not just healthcare but telecom, retail, everywhere, growing is easy. Growing profitably, growing sustainably is a more difficult challenge, because you need a foundation to handle that explosive growth. So we've made a lot of we have invested a lot of time, energy, efforts last 18 months in creating that foundation. As an organization, we are in probably the best financial condition. We are largest players, but we want to pursue this mission, because we are just in 9 states and 18 cities. There's a huge India out there waiting for high quality cancer treatment. So we want to pursue it. We would like to pursue it, where we also do it in a sustainable manner. So we are Gujarat and Karnataka are our dominant markets. We will continue to have a deeper penetration in this market. Maharashtra is our new upcoming market. It's grown very rapidly. We'll continue to invest in that. So we feel that one way of growing sustainably is go deeper in the markets that you are there. So from a management bandwidth, from a patient flow, from a from a risk mitigation perspective also. I mean, we saw in this pandemic that since patient couldn't travel, they went to their local places away from big cities, and they were quite happy. Some of them will stay there. So health is eventually a very local subject. Given a choice, I want to go to the closest place. So we want to go deeper in our markets. We definitely want to grow. The growth expansion is on a service portfolio aspect. There is a service portfolio aspects also. One of the things that we are very hopeful about is our Triesta Life Sciences vertical, which is our onco diagnostic vertical. That's a vertical. Cancer is getting diagnosed at a cellular and a genetic level, and that's what will alter the way we diagnose, the way we treat, the way we monitor cancer patients going forward. So we are investing. We're expanding our diagnostic services in a big way through molecular diagnostic, molecular imaging, digital pathology, genomics. We are investing in the latest technology that is available in the world. We're bringing some of that technology first time in India. So we feel that that kind of a service portfolio breadth, depth, expansion will eventually help us grow everywhere. So we're working very hard on expanding on multiple level, geographical expansion, kind of offerings we have. So it's an exciting time.
So can you tell us a little bit more about your role in genomics and genetic testing and diagnosis?
I will try my best. I'm not a doctor. I'm an
No,
engineer.
as an
I will
organization,
tell you as a layman, as
an organization,
or as an organization. See, cancer is a disease of genetic mutation. That mutation happens. Maybe you have inherited certain genes, or maybe it's because of external carcinogens like tobacco, or it could be because of the virus, like human papilloma virus, or it could be just normal aging process. I mean, human body is the most amazing machine that is out there. The cells divide, they grow, they divide, they grow, and they die. Right? When that circuit breaks and it becomes uncontrollable growth, that's a cancer. That's cancer, right? So the where the science of cancer treatment is moving towards is, earlier we used to treat a type of cancer or a cancer of a particular organ or a site. You would treat breast cancer, you will treat cervical cancer, you will treat lung cancer. But now the modern medicine science is telling us that you actually need to treat the particular genetic mutation. It may be there in a cancer of that you find in one organ and a second organ, but it might be the same genetic mutation. So the whole science is evolving towards identifying that, and therefore the treatments, right? The second piece of that is when you do this genetic analysis, okay, you may find that certain genes are resistant to certain types of drugs. So the other aspect that is coming into picture is then you know what drug your cancer is resistant to. So you use other drugs. So it's becoming a more targeted therapy. It's becoming a more personalized, precise way of treating a cancer patient. And I think, today we have more than 100 types of cancers. Okay, now couple that with, the genomics, you will probably have hundreds of types of cancer. And, the treatment will depend on, for that person's specific type of cancer, specific type of genetic mutation, specific genomic profile which may or may not be drug resistance to certain types of drugs. So it's becoming very personalized and precise, and therefore we are investing in this vertical. I think this will alter in many ways how we treat cancer in future.
So we've heard Mr. Raj Gore of HCG as a CEO. My last question to you is, what does Raj Gore as a human being do in his free time? What are your passions?
I when I am in nature, when I'm around wildlife with my camera, it's like, for me, it's like a meditation. When I look through my lens, in front of me, whether it's natural scenery or a wildlife or any object that I'm photographing, I'm really there. I'm just there. I'm mindful. I don't think of anything. For me, it's meditation. So my passion, it started with photography. It started with actually wildlife, love for wildlife. Then it evolved into photography. I'm hoping that going forward, I would like to do something more in conservation of nature, conservation of wildlife, conservation of endangered species. That's something that I feel is a natural progression for me in my hobby or in my passion. So that's what I like. I mean, every 2-3 months, I will find a weekend where I can pick up my camera and just either go to a wildlife park or go to a forest area and just walk around with my camera. I find, nature is such an amazing thing, and we know so little about it. That every time you spend time there, you have a new respect for the planet that we have. So that's what keeps me going and gives me balance in life.
Awesome. I mean, it's so beautiful to have a passion that helps you live in the moment, and it's been really lovely speaking with you. I really appreciate you taking our time to be with us on BW Dialogue for Business World Healthcare. And I wish you all the best for everything that you're doing at HCG.
Thank you so much. I really appreciate you reaching out to us. Look, one thing I think we all need to learn from this pandemic is we must make our health as a priority, as individuals first, before we ask our governments and all to make health a priority. Anyone who was healthy had the best chance to live through this pandemic. And we all know it, but we don't give it a priority, and we don't put the necessary time, energy, in taking care of ourselves. So please look after yourself. Please spread this message. I think we owe it to ourselves and our families that we look after our health. And thank you so much for this opportunity, and all the best to you too.
Thank you so much. What a beautiful message. Thank you.
Thank you.